As a busy occupational health professional, Bob wants to help his patients get better so they can return to their normal life activities as quickly and safely as possible. While he understands that evidence-based guidelines can help him provide better care for his patients, he's not entirely sure how they work and what their differences are. So, what is evidence-based medicine, and why is it important? Simply put, evidence-based medicine takes a systematic approach to clinical treatment by combining the highest quality evidence with expert medical consensus in order to form guidelines for patient care. But not all guidelines are the same. Some guideline creators cut corners to save time or money, and that puts patient care at risk. This is where MD Guidelines stands apart. Our practice guidelines developed are fully backed by high-quality medical evidence and expert clinical consensus. Here's how it works. It all begins with a question. Our team of medical experts formulates questions about a specific diagnosis, test, or procedure. Next, our university-based research team conducts extensive literature reviews, documenting search strategies, research methods, sources, search terms, and findings. Every detail is considered and analyzed. Our researchers then review and grade the medical literature to determine if a study is reliable. We look at things like study design, population sample, results, study sponsorship, and potential conflicts of interest. With the evidence in hand, our team carefully drafts the clinical recommendations. Each draft is reviewed and modified internally by a multidisciplinary panel of medical experts. Once approved, the guideline is then submitted for external peer review and stakeholder input. While some guideline creators simply review research abstracts and rely on questionable methodology, our research experts look at all studies and select those of the highest standard. All this research, checking and double-checking, takes significant time. In fact, it can take up to 12 months just to update an existing guideline, and up to 18 months to develop a new one. We believe every step of the process is important, and it's time well spent. For finish, our guidelines are in full alignment with national and international quality guideline creation standards. We even have a guideline methodology committee that oversees the entire process. With knowledge of the attention to detail that goes into creating evidence-based content, lines to help return his patients to their life activities quickly and safely. Features the world's most trusted evidence-based guidelines from the American College of Occupational and Environmental Medicine.